The Premier Desk system, we're going to go through generating a new claim, verifying membership, and submitting. We'll also look at the closure for the month and how you can go through and accounts management to see your queries and respond to the queries before submitting. There are two ways of generating a claim under claims processing and then pre-authorization. So we're going to see all these. First, log in with your credentials. And then you select your insurance company. That's Premier Health Insurance. So member verification. This is done under claims processing, where you have new visits. Under new visits, there are three ways to verify membership. You have the membership number, which is the default one, the Ghana card, and then the phone number. Any of these could be used. So once I have the person's membership number, you type it in the search box and click on view or enter. So let's take this example. You see the status is indicated here in green. Assuming the member were to be inactive, it will also indicate here in red, and you cannot proceed to generate a claim. But this member is active, so we can click on view to generate a new claim for the member. And once you click on view, under claims tab, you will now see this button to the right side, generate claim. So over here, we have a claim generated for the member. At this point, you can now capture your items. This is good for front desk persons, OPD or records, when you see the member for the first time, or the member you attend to the member as an initial step to caring for this member. So items could be captured. Items like consultation could be captured. But please take note, once you start typing its filters and a drop-down menu appears for you to select the item. You put in the quantity and the corresponding price. But remember to save. And after saving, you'll see a summary of those claim items down there. You can always add more than one item. So let's take an example. Co-item, there must be a drop down and then you indicate the price. Over here, quantity should not be left at 0. You put in a number and then you save. So I have two items on this member. Now let us assume that I made a mistake. I can always edit the figure or delete it altogether, delete that item altogether. So over here, my GP is supposed to be 95 instead of 100. So I update after doing the amendment, and the system will adjust the total figure accordingly. So once a claim has been initiated, the claims manager can now go and view all claims that are generated for the day within the facility by going to in use, the second line. In use, there you will see a list of all claims that have been generated or even started. Perhaps some items have been captured in those claims. The claims manager can now review these items and eventually submit by going to the actions view, and once you view, it brings you back to the initial page where you were generating the claim and a new claim. So the manager has to now see if everything is okay. But one thing is for sure, Before you submit, the system will prompt you. You must indicate the actual date of attendance, and if you have any comments, you type it in this comment. This is not compulsory. The comments is not compulsory. But please take note of a requirement. Add diagnosis before submitting. And this can be done on this tab, diagnosis, where you select one or more diagnoses for the patient. But remember to save. After selecting from the drop-down menu, you click on save. Initially, this will appear as a queried diagnosis. But before you submit, make sure that at least one of the diagnoses chosen will be a confirmed diagnosis. So I save the second diagnosis. Now, by clicking on queried, it toggles between queried and confirmed. Now I can submit the claim. So that is it for claims processing, new visit, and in use. Of course, if I want to view submitted claims, I'll click on submitted to view the claim I generated and submitted. Now, the second tab, pre-authorization, is similar to the first part. New pre-authorization follows the same rule. You'd use any of the three ways of verifying membership to search for the member. But for pre-authorization, approval must be given from Premier Health Insurance. So let us assume that we have this member coming to do a surgery. So I must search for the member and then key in the pre-authorization details, just like what I'll do for an existing claim. So I realize that there is pre-authorization generated for this member. So instead of clicking a new one today, I can view and capture some details. So this is myomectomy. We're going to charge 3,000 Ghana cedis. And this is an inpatient claim. So you change it from outpatient to inpatient by selecting change. And under the list of reasons, you select the reason for the change to inpatient. So this is a surgery, general surgery. Please, I now save and I get my feedback. Products created successfully. Once approval is given on this member, I will receive notification from Premier Health Insurance. And with this notification, I can now go into my approved claims to view all claims, approved pre-authorizations, to see all the pre-authorizations that have been approved by Premier Health. You see the notification, it comes at the top pane with red. That says you have one approved pre-authorization. So over here, I must go to my pre-authorization approved, click on view, approved. Did you notice Premier approved 2,500? So it means that for that claim, I can only capture up to 2,500. So this means I have to edit my figure to 2,500 and update. Once I update, I click on convert to claim. And this claim will appear under claims for in use over here. In use. So I have this 2,500 claim here under claims processing in use. So I can now go and submit my claim over here. Remember, for an inpatient claim, the discharge date is a requirement. So if it's going to be discharged in 2 days' time after the claims was generated, I must put in the discharge date and then eventually submit. So whilst this can be done for different members within a day or within the month, the system requires that you close your claims for the entire month. And this is how you do it. Under close claims, you select the month that you want to close. And then you view. Once you view, it gives you a summary before you close your claim. And once you have closed your claims, a batch number will be generated. And you can see this under Account Management, Claim tab. So all claims that have been submitted to Premier Health Insurance will have the automatic batch number generated. And with this reference number, you can now view the status of the claim. You can take action on the claim. So if the claim, we've finished working on the claim, you see awarded. This is received. And then on the right hand side, under actions, you can view the queries that are linked to that claim and respond to it for resubmission. Likewise, if there are no queries, you will see your payment advice, and you can now trace that payment from your bank. So this system is very user-friendly. Let's review what we've learned so far. First thing, for member verification, new visits. And you can use this same new visit to initiate a claim, generate a new claim and initiate. And if you are the claims manager, you can see all claims that have been generated when you go to in use. Once you are submitting the claim, you need to capture the diagnosis. And then pre-authorization can be used to initiate claims for surgical procedures, for opticals, and for dental. For MRI, any procedure that requires pre-authorization should be started from pre-authorization, whilst the general procedures that do not require pre-authorization, consultation, lab, drugs, can be started from claims processing. Then, whilst you can submit your claims on a daily basis, you need to close your claims for the month. And the system makes provision for you to review your claims queries for resubmission. So we are confident that this will be helpful. Please go through the system, and if you have issues to discuss with us, please feel free to get in touch, to give us feedback, and we will be there to address your questions. Thank you.